This unit, we're going to be showing you how to place a bedpan underneath your patients after they're requesting to have bowel movement.
Okay, so this patient has rung his call bell. He wants to get on the bedpan. There's two types of bedpans that you may see. You might even see the Verticare products, which are disposable ones that get put into a machine and then grind it up. These ones are reusable. So these are the ways that you're going to put it on. So the patient, for this one, it has the toilet seat. So that's how you're going to be placing it under the patient. And this one is a little bit different. If they have any sores, sometimes when they have spinal injuries, or you might need a more flat bedpan. And this actually gets turned the other way so that the pointy part is towards the head. So it's nice and flat on their back, and then they're sitting it on it like this.
So we're going to show you how we would position a patient and help them, assist them into a bedpan.
So we're going to get the bed obviously nice and high. If the patient can handle it, we're going to get him laying flat to place the bedpan underneath the patient.
Yeah, so if your patient is able to assist you and turn and lift their hips up, then you just need one person. You can just do this on your own. But if the patient is more immobile and not able to assist in terms of their care, you might need to get someone to help you.
Okay, so I'm going to get Mr. Black here to move to his side.
So we're going to use the flat bedpan here. You can see, you want to make sure you remove any linen, any gown, so that it doesn't get soiled. And what you want to aim for is kind of centered towards their coccyx here.
And sometimes you have to push down to get right there.
And then you're going to place, get the patient to roll back onto their back with the bedpan underneath, and kind of eyeball it to make sure that it's centered, and that if they do have a bowel movement, and sometimes it could be quite loose and watery, that it won't spill out onto the bed.
And obviously we do not use the washroom laying down, so let's get our patient up into a sitting position. They might want to bend their legs. We also want to make sure that we're providing some privacy. So sometimes it's nice to, if the patient's okay with it, just to put a blanket over them, and then make sure your call bell's within reach, so that when they're done, they're not having to yell for you. And make sure they're comfortable, and then you can leave the room and give them some time to have bowel movement. So now your patient is done and wants to be cleaned up. He's also requested to put a brief on. Okay. So when we're taking this bedpan out, we got to make sure that we're being very careful that we're not going to spill stuff everywhere. And obviously, if we are going to be taking a bedpan out, we're dealing with bodily fluids, so we would definitely be wearing gloves. So I'm just going to put the patient back down a little bit, always making sure that this is not going to spill anywhere. I'm going to get the patient to roll to his side, and obviously support this so it doesn't spill when I'm moving.
Right. So make sure this is full and I'll have gloves on. You want to do some peri-care for your patient as well. Wiping from the front back towards the back, okay? Once it's all clean, you can dispose of your bedpan. And then this patient is requesting to have a brief on. This is a typical brief that she'll see on your unit, okay? And you just kind of make sure that the Velcroed part goes onto their back. Just place like that. And you want to just aim to be at the center of their coccyx here so that we can Velcro it on properly, okay? You want to ask the patient, Mr. Black, to come back down.
I want to make sure that there's enough brief to go over the front area too, so not that everything is in the back.
And then make sure your partner is able to grab that Velcro piece there, and then you're going to secure it, not too tight but not too loose that contents might come out.
You don't want to cause any pain. And you don't want to cause any restriction here around the legs that's going to cause redness and irritation and skin breakdown.